Every summer, millions of people seek refuge from the heat in the cool embrace of freshwater lakes and water parks. They are oases of joy and laughter. But beneath the shimmering surface of the water, an ancient, invisible predator can sometimes lie in wait. An organism so perfectly evolved to kill that an encounter is almost always a death sentence. This is the story of one such encounter. For 12-year-old Kaylee Hardig, July 18, 2013 was supposed to be a perfect summer day. She spent the afternoon with friends at Willow Springs Water Park in Arkansas, a recreational lake famous for its giant slide and jumping platforms. But as she was leaving, a sharp, unfamiliar pain began to throb in the front of her skull. When she got home, she told her mother, Tracy, about the headache. Tracy wasn't overly concerned. It had been a hot day.
Perhaps it was just dehydration. But the following morning, everything changed. Tracy went to wake her daughter, but Kaylee couldn't lift her head from the pillow. She could barely open her eyes. Within hours, she was vomiting uncontrollably. Panicked, Tracy grabbed a thermometer. The reading was 103 degrees. She carried her daughter to the car and raced to the Arkansas Children's Hospital, praying it was just a severe case of the flu. A few hours later, Tracy and her husband Joseph were called into a sterile, quiet conference room. The doctors who entered had grave expressions on their faces, and the news they delivered was a parent's worst nightmare. Their daughter, they explained, had not contracted the flu. Her brain was being attacked by a microscopic parasite, a rare and terrifyingly efficient killer known as a brain-eating amoeba. The prognosis was blunt and brutal. Kaylee would likely not survive the weekend. In this investigation for Medical Obscura, we will dissect the case of Kaylee Hardig. We will explore the mysterious biology of her attacker, Naegleria fowler, and we will follow the desperate, minute-by-minute battle fought by doctors against a nearly unbeatable foe. For Kaylee and her family, one question became the most important in the world. In the face of near-certain death, is survival even possible? Tragically, the Hardig family was no stranger to hospitals. Kaylee's mother, Tracy, was in the middle of her 6th battle with breast cancer. Her husband, Sergeant Joseph Hardig, had just flown home from a tour in Kuwait to care for her. This history of medical crises likely sharpened Tracy's instincts. The morning of July 19th, as soon as Kaylee was too drowsy to get out of bed, Tracy was on the phone with the hospital. But as her daughter began to vomit relentlessly and her fever spiked, Tracy knew she couldn't wait for an afternoon appointment. She called her husband. "I don't know if she's going to make it that long," she told him. She had to get Kaylee to the emergency room, now. Upon arrival, Kaylee was immediately moved to the intensive care unit, the ICU. Her condition was deteriorating rapidly. The fever dehydrated her, and though she was hooked to an IV, she begged for water. But the nurses couldn't give her any. Her state was so unstable, they feared she might stop breathing at any moment and require intubation. The doctors, piecing together the clues, formed a tentative diagnosis. The severe headache, the high fever, the vomiting, the extreme drowsiness, it all pointed to a classic case of bacterial meningitis, a dangerous infection of the membranes surrounding the brain and spinal cord. It progresses quickly and requires immediate treatment with powerful antibiotics. But the lead physician, Dr. Don Foster, knew he couldn't afford to be wrong. He needed to be 100% sure. He ordered a spinal tap. Nurses placed the delirious Kaylee into a fetal position. A large, hollow needle was inserted into her lower back to extract a sample of the precious cerebrospinal fluid that surrounded her brain. The procedure was painless, but Kaylee was already lost. Soon after, she began to hallucinate, mistaking the nurse's station for a cafeteria. For the medical team, this was a terrifying sign. Hallucinations only appeared in the most severe cases of meningitis. Things were not looking good. The spinal fluid was rushed to the microbiology lab. There, a technician named Tamika Reed placed a drop of the fluid onto a glass slide and looked through her microscope. Doctors were expecting to see bacteria, but what Tamika Reed saw was something else entirely, something far, far worse. That night, Kaylee's father, Joseph, arrived at the hospital. Moments later, 2 doctors escorted the Hardigs into a private conference room and shut the door. They explained that the tests did show a massive number of white blood cells in Kaylee's spinal fluid, a sign her body was desperately fighting a severe infection, causing dangerous swelling in her brain. But there was no bacteria. Instead, under the microscope, they had found it, a tiny whitish organism barely larger than a blood cell. It was called Naegleria fowleri, better known as the brain-eating amoeba. Finding the amoeba so quickly was in itself a small miracle. The organism is so small and so similar in appearance to a human white blood cell that it is incredibly easy to miss during a routine lab test. This deadly infection, known as primary amoebic meningoencephalitis, or PAM, is extraordinarily rare. In the 50 years prior to Kaylee's case, only 128 infections had ever been reported in the entire United States. The Arkansas Children's Hospital had seen just 2 of them. Both patients had died. The symptoms Kaylee was experiencing were a textbook match. First, the headache and fever. Then, the hallucinations, which signaled she was entering the terrifying second stage of the infection: altered mental status, seizures, and eventually coma. Her doctors knew the worst was yet to come. But amidst this devastating diagnosis, there was one single piece of positive news. Tracy Hardig's quick thinking, her refusal to wait for an appointment, had bought them something more precious than any medicine: time. In the vast majority of PAM cases, the diagnosis comes far too late, often after the patient has already died. Kaylee's early diagnosis gave her the slimmest of chances. The doctors explained the brutal mechanics of the infection. Once Naegleria fowleri enters the body, it begins to feed on brain tissue. The body's immune system responds by sending a flood of white blood cells to the site of the attack. This is what causes the massive inflammation and brain swelling, and it's why the infection so closely mimics bacterial meningitis. But as the brain swells, it has nowhere to go. It presses against the inside of the hard, unyielding skull, a process called herniation. Eventually, the pressure cuts off blood flow. The average patient dies just 5 days after the first symptoms appear. If they couldn't find a way to stop the swelling and kill the amoeba, Kaylee had no chance. The Hardigs were stunned. How could this happen? The doctors explained it was a case of horrific, random chance. Kaylee had been swimming in the amoeba's preferred environment: warm, fresh water. The organism had entered her body in the only way it can infect a human: through the nose. From there, it attaches itself to the olfactory nerve and travels up the nasal cavity directly into the brain. And once it's there, it begins to feast. The infection is not contagious. You can't get it from drinking contaminated water. The amoeba must enter the nose to survive. A simple splash of water, a cannonball jump, that's all it takes. The hospital had already summoned its top infectious disease specialist, Dr. Matthew Lynham. He was on his way. The fight was no longer against a bacteria, but a parasite. They would need a completely different and far rarer set of weapons. Tracy Hardig, a woman who had survived 5 recurrences of cancer, knew what it meant to beat the odds. But she had never faced anything like this: an enemy that was literally eating her daughter's brain from the inside out. There is still so much that science does not know about this deadly amoeba. Studying it is incredibly difficult.
First, the infection is so rare, with only a handful of cases reported each year, that large-scale clinical trials are impossible. Second, it is often misdiagnosed as meningitis. In fact, 75% of all PAM diagnoses are made during the autopsy, after the patient has already died. This means the true number of cases could be much higher than we think. Researchers, left to study PAM on a case-by-case basis, have only been able to identify a few disturbing trends. The infections are most common in the southern states, like Florida and Texas. They occur almost exclusively in the late summer, when freshwater temperatures rise above 86 degrees Fahrenheit, creating a paradise for Naegleria fowler. And the Willow Springs Water Park, it turned out, was one such paradise. When the Arkansas Department of Health investigated the site, they found that while the water was chlorinated, the levels were not high enough to kill the dangerous organism. But their investigation uncovered something even more horrifying. Kaylee was not the first. 3 years earlier, in 2010, a 7-year-old boy named Davian Briggs had also visited Willow Springs. A day later, he developed a headache and a stiff neck. 2 weeks later, he was dead. The cause of death? Naegleria fowleri. The park's owners, heartbroken, immediately agreed to close their business for good. But the mystery of the amoeba only deepened. Even if one were to avoid every lake and water park, they still might not be safe. In June of 2011, a 28-year-old Louisiana man named Jeffrey Cusimano died from PAM. The source of his infection puzzled doctors. His family insisted he hadn't been swimming in any fresh water. Just months later, a 51-year-old woman in the same state died of the same infection. And again, no swimming was involved. But this time, her parents offered a startling clue. Their daughter suffered from sinus problems, and to clear her nasal passages, she frequently used a tool called a neti pot. A neti pot is a small container used to rinse the sinuses with a saline solution. The spout directs water through one nostril and out the other. Investigators immediately tested the tap water in the woman's home. It came back positive for Naegleria fowleri. The instructions for a neti pot are very specific. Always use distilled or previously boiled water. Both victims had used contaminated tap water. The amoeba hadn't found them in a lake. It had found them inside their own homes. The discovery of Naegleria fowleri in a public water system sent a wave of panic across the country. The CDC would eventually find the amoeba in multiple locations throughout Louisiana's waterlines. The problem, microbiologists suggested, was the use of chloramines as a disinfectant, which, under certain circumstances, are less effective against this specific amoeba than traditional chlorine. In 2013, this vulnerability led to another tragedy. A 4-year-old boy in Louisiana died from PAM after playing on a slip-and-slide connected to his family's garden hose. This raises a terrifying question. If the amoeba is potentially everywhere, in lakes, in rivers, even in our tap water, why do so few people get sick? It's possible that millions are exposed every year, but very few suffer the consequences. One theory suggests that many people may have natural antibodies that fight off the amoeba before it can reach the brain. But this hasn't been proven. What is known is who is most at risk. Over 80% of victims are male, and tragically, more than 60% are children under the age of 13. Researchers still aren't sure why. The doctors at Arkansas Children's Hospital knew all of this. They knew Kaylee was now a statistic in a grim and mysterious pattern. But because they had diagnosed her while she was still alive, she had something that almost no other victim had ever had: a chance. Now, they just had to figure out how to cure her, a feat that, out of 128 attempts in the United States, had only been accomplished twice before. Dr. Matthew Lynham, the infectious disease specialist, immediately took charge of Kaylee's treatment.
He started a cocktail of powerful antibiotics and antifungal medications. To combat the terrifying swelling in her brain, surgeons drilled a tiny hole into Kaylee's skull and inserted a catheter to drain the excess fluid. But despite their efforts, Kaylee was fading. She drifted in and out of consciousness. The swelling was relentless. The medical team agreed they had only one option left. They needed a rare, experimental, and dangerous drug called miltefosine. And here, in the darkest moment, came the first true miracle of Kaylee's story. For decades, miltefosine had to be shipped from Germany, a process that took over a week, far too long for a PAM patient. But in a stroke of incredible luck, the CDC had received its first domestic supply of the drug just 2 months before Kaylee's infection. The timing was unbelievable. On July 19th, the same day of her diagnosis, Dr. Lynham sent an urgent request to the CDC. It was approved immediately. The next day, Kaylee's miracle drug was shipped from Atlanta, Georgia, on its way to Little Rock. Everyone waited. The doctors monitored Kaylee's vitals, fighting a desperate holding action against the swelling in her brain. They expected the miltefosine to arrive within 24 hours. But the amoeba could kill her at any moment. A full day passed. The medicine was taking too long. A restless Dr. Lynham called the CDC. They confirmed the shipment had been sent. A nurse tracked the delivery service. They confirmed it was put on a plane. The airline was contacted. They confirmed the plane had landed in Little Rock. But the medication was nowhere to be found. Kaylee's miracle drug was lost. Her parents were frantic. Kaylee was getting worse by the hour. The pressure on her brain was now so severe it was affecting her breathing. Doctors were forced to insert a breathing tube down her throat just to keep her alive. All they could do was pray that the lost package would miraculously appear. And somehow, it did. It's still unclear exactly how the miltefosine was recovered, but on Sunday, July 21st, just 3 days after her exposure, the drug finally arrived at the hospital. The medical team launched their final desperate assault. They began administering the miltefosine. The next day, they started an aggressive cooling procedure, lowering Kaylee's body temperature from a feverish 103 degrees down to 93. This, they hoped, would slow the swelling. Finally, she was placed in a medically induced coma, a last-ditch effort to allow her brain to rest and heal. Now, all they could do was wait. As Kaylee lay in her coma, her mother Tracy went on the local news, telling her daughter's story as a cautionary tale. Her message reached other families who had been touched by the same tragedy. Days passed. The doctors were cautiously optimistic. The swelling in her brain had finally subsided. But the powerful drugs were taking a toll on Kaylee's kidneys, forcing her onto dialysis. And the biggest question of all remained unanswered. Even if she beat the infection, how much of her brain had the amoeba destroyed? Would she ever wake up? Then, in late July, the news they had all been praying for. Test results from her spinal fluid came back. 0 signs of Naegleria fowleri. The amoeba was gone. Now came the most terrifying moment. Doctors began to slowly raise her body temperature and bring her out of the coma. By August 5th, 18 days after her diagnosis, Kaylee moved her head. Her parents cried out as she weakly reached a hand towards her mother. The girl who wasn't supposed to survive the weekend was awake. The battle had left scars. At first, she couldn't walk, read, or write. But on August 12th, she scrawled her name in big, shaky letters. And a week after that, she spoke her first words in a month. She looked at her mother and said, "Hi, Mama." From there, Kaylee's recovery was astonishing. She relearned how to speak, how to write, and how to walk. She even, after an understandable hesitation, relearned how to swim. But as Kaylee grew stronger, her mother Tracy received a piece of heartbreaking news. The family of another child, a 12-year-old boy from Florida named Zachary Reyna, had reached out. Zach had been infected within weeks of Kaylee. He had received the same miracle drug, miltefosine, and just like Kaylee, the drug had worked. His spinal fluid also came back with zero evidence of the amoeba.
But Zach's fight was not over. When doctors brought him out of his coma, he did not wake up. The amoeba was gone, but the damage it had left behind was irreversible. Zach was declared brain dead. He never got the chance to squeeze his mother's hand. Why did Kaylee survive and Zach did not? The mystery of the amoeba endures. Perhaps Kaylee's incredibly early diagnosis gave her the crucial advantage.
Or perhaps, as some scientists theorize, not all amoebas are created equal. It's possible that some strains are simply more virulent, more aggressive than others. Zach may have been doomed from the start. On September 11, 2013, after 55 days in the hospital, Kaylee Hardig was discharged. She went on to make a full neurologic recovery. She returned to her life, to her passion for swimming, though now she always wears nose plugs. She also became a powerful advocate, speaking publicly about her experience to raise awareness of this invisible killer. Because of the stories of Kaylee and Zach, miltefosine is now the recognized standard of care for treating PAM. But the threat is growing. Scientists believe the increasing number of cases is due to two factors. First, and most alarmingly, climate change. As global temperatures rise, more bodies of fresh water are becoming warmer for longer periods of time, creating more and more breeding grounds for Naegleria fowleri. Cases are now being reported farther north than ever before. The second factor is awareness. Thanks to survivors like Kaylee, more doctors are able to correctly identify the infection, meaning more cases are being accurately recorded. Kaylee Hardig's case remains one of only a handful of survival stories in the history of this devastating infection. Her recovery is a testament to her own strength, her mother's intuition, and the relentless innovation of the doctors who refuse to give up. Her story is a beacon of hope in the face of an ancient and terrifying medical mystery. The story of Kaylee Hardig is just one file from our archives. There are countless others, each a testament to the enduring mystery of the human body and the strange paths medicine has walked. If you wish to uncover more of these forgotten stories, subscribe to Medical Obscura and press the notification bell. Join us as we continue to explore the shadows where science and the unexplained collide. We have many more cases to open.